Hello everyone, my name is Dr. Omida and we continue with our lecture series on histology of the endocrine glands. We left it at adrenal cortex. So we said you have zona glomerulosa that produces aldosterone, to increase sodium reabsorption in the distal convoluted tubules. Zona fasciculata produces glucocorticoids or cortisol, which is a stress hormone and also helps with the metabolism of carbohydrate, protein, and lipids. And zona reticularis that produces androgens that help with secondary sexual characteristics. So the clinical correlates of the adrenal cortex, we have Addison's disease, where we said you have decreased adrenocortical hormone reduction. Okay, so when you destroy the cortex of the adrenal gland, like in autoimmune disease or tuberculosis, you can cause Addison's disease because the adrenocortical hormones will not be produced. We also have Cushing's disease. You have hyperadrenocorticism. So it's now overworking. So when you have a tumor, for example, of the anterior pituitary gland, you increase adrenocorticotrophic hormone. Remember, the same way thyroid gland needed thyroid stimulating hormone from the anterior pituitary, adrenal cortex needs adrenocorticotrophic hormone from the anterior pituitary to control its secretions. So when you have a tumor of the anterior pituitary, you get Cushing's disease because now your adrenal cortex will be overworking. It's being because of production of ACTH. So you'll get hypertrophy of the cortex, you overproduce cortisol, and when cortisol is high, you get obesity at the trunk, the bone lose the density, so osteoporosis of bone, muscles will waste. So we usually say the patient looks like an orange standing on two sticks. Okay, so the orange fruit standing on two sticks. Why? The limbs look like two sticks because the muscles are wasted. And then then the males become impotent. The females can present with amenorrhea, where the menstruation is absent. Okay, so then we have adrenal medulla, which we had already said that it's at the central portion of the adrenal gland, and it's ectodermal in origin from the neurocrest cells made of chromaffin cells mainly, which produce epinephrine and norepinephrine. And remember, these cells, the chromaffin cells, communicate with the sympathetic ganglion cells. Okay, so they are actually scattered within the connective tissue of the adrenal medulla. The next endocrine gland is the pancreas. The gross anatomy and the details of the pancreas is described in the lecture video on the abdomen. So here we'll only focus on the endocrine part of the pancreas. So pancreas lies posterior to the stomach between the duodenum on the right and its tail is at the hilum of the spleen on the left. It has an exocrine pancreas that will release alkaline juice containing enzymes into the duodenum, second to the duodenum, through the sphincter of Oddi by uniting with the common bile duct. Then we have the endocrine pancreas that is formed by the islets of Langerhans. Okay, this produce glucagon and insulin that will enter the blood. Gross anatomical parts, you have the head, the neck, the body, tail, and there's an uncinate process. Okay, so this is the head, the neck, this is the uncinate, is the body and the tail. The relations, blood supply, innervation of the pancreas has been covered in a gross lecture, so I will not discuss it here. So the exocrine pancreas will produce alkaline fluid with the following enzymes that help with digestion. So lipases to digest lipids, proteases, amylases, trypsinogens. These are the enzymes that are contained in the pancreatic juice together with water and ions. Then our main focus here is the endocrine pancreas. Now, exocrine pancreas appears, you have, since they're producing these enzymes are protein in nature, so the exocrine pancreas will have featured protein synthesizing cells. So there will be dark nuclei, large endochromatic nucleus, prominent nucleolus, basal, rough endoplasmic reticulum, and so on and so forth. But the endocrine pancreas, they are lightly stained. So you'll just see a lightly stained islands within the exocrine pancreas. And because it's endocrine, it's richly vascularized because you're going to release your secretions, the hormones, directly into blood. So what are the cells in the endocrine pancreas? The beta cells that produce insulin, alpha produce glucagon, delta that produce somatostatin, PP, which is pancreatic polypeptide, and G, which are gastric producing cells. Okay, so beta cells produce insulin, and insulin helps to lower blood glucose level. Remember, we said when you take a meal of carbohydrate, immediately after digestion, there is reabsorption, you raise blood sugar levels. If it's too high, the pancreas will get the information to produce insulin. Where are the receptors for insulin? In the liver, skeletal muscle, and adipose. So when insulin binds onto this receptor, it will make these cells to take glucose from blood. That way you lower blood glucose level. After staying for some time without eating, your blood sugar level goes down. So what happens? Alpha cells are told to produce glucagon. Glucagon now informs the liver from the stores that you have. You stored the glucose as glycogen before. Now you need to break down this glycogen and form glucose. So gluconeogenesis will occur, or glycogenolysis, that you increase the blood sugar level. Delta cells produce somatostatin. Somatostatin is inhibitory. It tends to reduce peristalsis, reduce gallbladder contractions, and so on and so forth. So what are you able to see here? You can see the exocrine pancreas. These are pancreatic signals. Go back to the histology of GIT organs. You see the description on the pancreatic acinar. So these are acinar cells, and where the duct begins, you appreciate the acinar cells. So exocrine pancreas, the cells have features of protein synthesizing cells. So the acinar cells are pyramidal with prominent nuclei, large and chromatic nuclei, prominent nucleoli, basal rough endoplasmic reticulum, and Golgi apparatus that produce protein. Basal rough endoplasmic reticulum and ribosomes produce protein, and then on the apices you'll have the zymogenic granules containing the enzymes. Okay, but you can appreciate this is the islet of Langerhans. Okay, separated from the exocrine pancreas by connective tissue. They are lightly staining cells within a dark staining background of exocrine pancreas. Okay, identify the structure. This is the pancreas because there's a presence of exocrine pancreas, which are darkly staining, and an island of light staining, islet of Langerhans, containing the endocrine cells. So beta cells, insulin that decreases glucose. When insulin is released, there are insulin receptors on skeletal muscle, liver, and adipose cells. They make these structures to take up glucose, okay, when blood glucose level is high. And when blood glucose level is low, glucagon will be produced by the alpha cells, and this will initiate gluconeogenesis and glycogenolysis so that you increase the blood glucose level. Delta cells produce somatostatin and vasoactive intestinal peptides. Somatostatin acts on smooth muscles of GIT and gallbladder and reduces their motility. So somatostatin is inhibitory to the GI. It's released in response to increased level of blood glucose and amino acids or chylomicrons that occur after a meal. So after a meal, all these glucose amino acids will be increased, so somatostatin will be released. Vasoactive intestinal peptides also induce glycogenolysis and hyperglycemia, and they also regulate intestinal motility. So VIP controls secretion of ions and water by intestinal epithelial cells. So how this VIP and somatostatin function, somatostatin, how the two of them function, it will again be explained in your physiology lecture. So when you cover physiology of GIT, remember to pay attention to that and ask your questions in class on how these hormones work in detail. Gastrin is released by the G cells, and they stimulate gastric release of hydrochloric acid. They also stimulate gastric motility and emptying. Okay. Then we have pancreatic polypeptide, which is a hormone that's produced by PP cells. What's the function? It inhibits the endocrine secretion of the pancreas and also stimulates the release of the enzymes by gastric chief cells. Remember, chief cells of the gastric usually produce these are the parietal cells, so the chief cells. They produce hydrochloric acid and also usually produce intrinsic factor that help with vitamin B12 production. So pancreatic polypeptide is produced by the PP cells of the islets of Langerhans, and they inhibit the exocrine pancreas and also stimulate the release of enzymes by the chief cells. Remember, the chief cells chief cells in the stomach, yeah, they produce hormone, the protein enzymes, okay? And then we have parietal cells that produce hydrochloric acid and also produce intrinsic factor that help with B12 absorption at the terminal ileum, okay? So what are the clinical correlates? Of course, we have diabetes mellitus. We have type 1 mellitus and type 2 diabetes. So type 1 is mainly in children. It's congenital, where you do not have B cells, so you lack insulin production by the B cells. But type 2, you have the B cells that are functioning. So in type 1, B cells are not functioning. Type 2, B cells are actually functioning. They're producing insulin. But the problem is the target organ. The receptors are defective. So this is mainly seen in adults, okay? And it's exacerbated, or rather, it will be caused by sedentary lifestyle, okay? If you're not exercising and not eating a good diet and all that, blood sugar is always high. So all those things contribute to all this. So in type 1, you can have beta cells are not functioning, or autoimmune condition where you've destroyed your B cells, so you can't produce insulin. So these children, from birth, you need to give insulin. But in type 2, you're producing insulin, yes, but it's like your body is not sensing that you're producing insulin. Why? Because the receptors are defective. They're not detecting this insulin. Okay, so that's the difference between type 1 diabetes mellitus and type 2 diabetes mellitus. So that's it about the endocrine glands in the body. So go back to your textbooks and get more details. This was just sort of a summary of the histology of these endocrine glands. Thank you very much.